What is hypertension? Hypertension means sustained increased blood pressure. The pressure, increased blood pressure, it should be sustained. It will be continue. It should continue. Otherwise, normally what happens when we will be exercising, our blood pressure will be increased, and when we will take rest, immediately it will come down. So this is not hypertension. So this increased blood pressure has to be sustained. So when the blood pressure is sustained, then we will call it hypertension. And this hypertension means increased blood pressure, increased systolic pressure as well as increased diastolic pressure. One thing you must remember, that is systolic blood pressure is due to increased heart rate, increased stroke volume mainly. And diastolic blood pressure, it is because of increased peripheral resistance. Okay, so these are the basic things you must remember. So mainly the systolic blood pressure is due to increased heart rate and stroke volume mainly, and to some extent peripheral resistance is also responsible, but mainly heart rate and stroke volume. And for diastolic blood pressure, it is mainly due to peripheral resistance, constriction of blood vessels. This hypertension is classified. There are different grades of hypertension. Normal is systolic blood pressure should be 120 millimeter of mercury, and diastolic blood pressure should be below 80 millimeter of mercury. And pre-hypertension, what is when hypertension blood pressure is 120 to 139 millimeter of mercury systolic blood pressure, and diastolic blood pressure is 80 to 89, then we will call it pre-hypertension. And hypertension stage 1, in this case, systolic blood pressure will go beyond 140 and it may reach up to 159. And diastolic pressure will be 90 to 99 millimeter of mercury. And hypertension of stage 2, this will be stage 2. The hypertension of stage 2, it is beyond, systolic blood pressure is beyond 160 millimeter of mercury, and diastolic pressure is more than 100 millimeter of mercury. So these are the different grades of hypertension. Okay, you try to remember this. Now we'll categorize hypertension into primary or essential and secondary hypertension. Primary hypertension means there is, what is the cause? It is not known. It is unknown. Primary hypertension, specific cause is not unknown. This condition is seen in absence of any underlying diseases. So, and 90 to 95% cases of hypertension E belongs to this category. And only 5 to 10% belongs to secondary hypertension. Here the cause is known. Underlying causes are there. So because of some disease process in the body that develops secondary hypertension. Okay? So in secondary hypertension, its percentage prevalence is much less. Mainly it is the primary hypertension or essential hypertension. And cause of secondary hypertension is there should be a cause. There is underlying diseases are there. We will see what are the different diseases that cause secondary hypertension. Okay? Now, the essential hypertension is again classified into benign and malignant. Benign means this sort of hypertension will not cause any harmful, it will not cause any harm in the body. But it is not true. It is not true. Actually, this benign HTN, hypertension, it is, in old days it was used to, this term is used. Nowadays it is not used. Nowadays instead of benign HTN, we call it primary or secondary hypertension. Mild or moderate hypertension. When there is mild and moderate hypertension, that is actually designated as benign. We cannot tell that this is benign. Benign means it will not produce any harm. But all the hypertension definitely is going to harm your body. So the benign term is not appropriate actually. That's why this term is not used nowadays. Okay, instead we use mild to moderate hypertension. Okay, another is malignant hypertension. And this regarding this malignant, more often this question is given in your different exams. Benign hypertension, as I said, this is an outdated term. Why it is outdated? The term implies that this type of hypertension does not cause any problem. But this term is misleading because even mild to moderate hypertension can cause health risk and never benign. So it is never benign. It is defined as the essential hypertension that is idiopathic, reason is not known, idiopathic, that runs a relatively long and symptomless course. Means it runs for a long time, even it remains undiagnosed because it doesn't produce any notable symptoms. That's why it remains undiagnosed. When the pressure gradually, progressively rise to near about 200 millimeter of mercury systolic pressure and diastolic pressure goes beyond 100 millimeter of mercury pressure, then only some symptoms develop. Then it is diagnosed that the person is having hypertension. Okay, so when it goes beyond 200 systolic pressure and diastolic pressure more than 100, then it is going to affect your body organs, brain, heart, kidney and eye, retina particularly. So these are the targets of hypertension. So that will affect these main 4 organs of our body. In benign case, when it is high, not beyond 200 millimeter of mercury, in that case, if the person is given rest or takes proper sleep, then it comes down to normal. But in case of other hypertension, it is not so. The malignant hypertension, sudden and rapid onset of hypertension. Suddenly, pressure is increased and rapid progression. It is going to target its organ, means it is going to hamper the cardiac activity, hamper the cerebral activity, hamper the retina, hamper the kidney. Okay, so these are the malignant hypertension. That's why it is called malignant. It is going to affect the main organ of the body. And when in this case systolic pressure rises in excess of 200 millimeter of mercury and pressure rises beyond 120 millimeter of mercury. So what is the difference between that and this one? Here this primary hypertension, one type of hypertension, it develops very rapidly and progressively, very fast, and targets these 4 main organs of the body. And it is very quickly, it attains 20 millimeter of systolic blood pressure and 120 millimeter of diastolic blood pressure. Now the secondary hypertension, we know there is, in case of secondary hypertension, there is cause. Because of the different diseases, this secondary hypertension develops. Now what are the causes? We will get 1, 2, 3, 4, 5 causes we will explain. So here are 4 causes. One is cardiovascular hypertension. It is produced due to the cardiovascular disorders, such as what are these disorders? Narrowing of the aorta, coarctation of the aorta. When the main aorta becomes narrowed, pressure rises. And due to atherosclerosis. So in atherosclerosis, what happens? Blood vessels becomes narrowed because of deposition of atherosclerotic plaque in the innermost layer. Also what happens, in essential hypertension, not in secondary hypertension, in essential we will see the thickness of particularly in elderly person, thickness of the wall of the arteries becomes increased. Muscular cord as well as intima, both are increased. Elasticity of the outer layer is decreased. So as a result, hypertension develops. Okay, so these are the cardiovascular or cardiogenic hypertension. Another is endocrine hypertension. It develops mainly because of adrenal cortex. In adrenal cortex, aldosterone is secreted, and this aldosterone causes water retention and sodium retention in the body. So blood volume is increased. As a result, blood pressure is increased. Similarly, there is tumor. There is tumor in the adrenal medulla. Adrenal cortex, adrenal medulla. Adrenal medulla is responsible for the secretion of adrenaline. Now we know adrenaline increases heartbeat, adrenaline causes vasoconstriction. So thereby it is going to increase the blood pressure. And this pheochromocytoma is a tumor of the adrenal medulla. Here what will happen? Epinephrine or adrenal will be secreted in large amount, and thereby it will cause hypertension. And Cushing syndrome, another is hyperaldosteronism. I said in renal cortex, one of the cortical enzyme is aldosterone. It increases water absorption as well as sodium reabsorption from the renal tubule. As a result, blood volume is increased, and because of this increased blood volume, blood pressure is increased. Okay. Another is Cushing syndrome. It is seen in Cushing syndrome. What happens in Cushing syndrome? Glucocorticoid secretion from the renal cortex is increased. Okay, and this also causes water retention as well as sodium retention. Thereby, it will be increasing the blood volume and blood pressure. So these are the endocrine hypertension and renal hypertension. One of the important factor in renal hypertension is renin-angiotensin system. Okay, if the JG cells, juxtaglomerular cells, in some cases the JG cells are, a tumor is seen in JG cells. So now what will happen? It will produce lot of renin. Now this renin will convert lot of angiotensinogen into angiotensin 1, and this angiotensin 1 will be converted into angiotensin 2 in the by ACE enzyme, angiotensin converting enzyme. These are present in the capillaries of lung. So they convert angiotensin 1 into angiotensin 2. Now this angiotensin 2 is a strong vasoconstrictor. It causes vasoconstriction of the blood vessels. As a result, blood pressure is increased. Not only this, it also increases aldosterone secretion. It stimulates adrenal cortex secretion and stimulates aldosterone secretion. Now we know aldosterone also causes water reabsorption. More water reabsorbed, more sodium ion, so blood volume increases, thereby it decreases hypertension. And so renin is one of the important. So this is blocking the ACE is one of the measure of controlling hypertension. When some drugs are available, what is the mechanism of action? It will block the activity of the ACE. Now the ACE, angiotensin carbonate, means what it causes? It converts angiotensin 1 into angiotensin 2. Angiotensin 2 is a vasoconstrictor. The angiotensin 2 binds with some receptor present in the blood, in the smooth muscles of the blood vessels. So some drugs are there, hypotensive drugs. So these drugs actually blocks the binding of angiotensin 2 to these receptors. As a result, blood vessels cannot be constricted. So thereby hypertension can be prevented if it is mediated by renin. Okay, so another cause is in glomerulus. There is afferent arteriole, renal arteries. So if these arteries are stenosed, means when there is stenosis, the lumen will be narrowed. Means what will be the less blood flow will be there in the, less filtration will be there. So in the body, what will be the water will be retained, sodium will be retained, blood pressure will be increased. So thereby stenosis also causes hypertension. Tumor in the JG cells, as I said, it will now, this tumor will produce lot of renin, and this will cause angiotensin 2 conversion, and this angiotensin 2 is a vasoconstrictor, thereby it will increase blood pressure. And some disease like glomerulonephritis, inflammation of renal glomerulus of the nephron. What will happen if it is inflamed? So this glomerulonephritis, in pyelonephritis. Pyelonephritis means infection of the urinary tract. So a lot of females suffer from UTI. So actually, initially it spreads in the urinary bladder, then it extends into the ureter. From the ureter, it enters into the renal pelvis, renal calyces, and in the nephron. So, and in the glomerulus. And in this way, it develops pyelonephritis. So, pyelonephritis is another cause of hypertension. Okay? Polycystic renal disease. Polycystic renal, more often, if you ultrasonography of kidney is done, in renal cortex, it is found some fluid-filled gaps are there in the renal cortex. Fluid filled area, these are benign. These are actually called benign cyst. These cortical cyst, renal cortical cyst. So when there is more number of renal cortical cysts, so in that case, hypertension may develop. Next is hypertension during pregnancy. You might have heard. So it is also when the pregnancy is risky. When the pregnancy is high risk and is complicated. Particularly this is seen in those who are having more than 35 years of age. So when the girls, women become pregnant after 35 years of age, so this pregnancy is usually risky pregnancy, complicated pregnancy. Okay, here what happens? They may develop preeclampsia. Preeclampsia means increased blood pressure, and it may develop into eclampsia. Means when eclampsia is developed, so there will be seizure, there will be convulsions, and the patient is at risk. Patient may die also. So these are what happens actually in this type of blood pressure, hypertension. During pregnancy, in such pregnancy, complicated pregnancy, the placenta secretes some hormones, vasoconstrictor hormones. So these increased vasoconstrictor hormones causes vasoconstriction, thereby it increases blood pressure. It also secretes more and more number of amount of estrogen, progesterone. These high levels, low level of estrogen, progesterone, one thing. Among gender, male, when you compare hypertension between male and female, you will find the prevalence of hypertension is very less among the females. Why? Because the females, they produce some reproductive hormones, estrogen and progesterone. Both these hormones are what? Vasodilator. So blood pressure cannot rise, cannot increase, hypertension cannot develop. Moreover, they prevent atherosclerosis. Now, moreover, they prevent increased secretion of renin. So thereby, because of these changes in the female, the rate of hypertension is much less than the male. But in male, what happens? The function of the testosterone is just opposite. It favors hypertension. Okay, so these are the causes of pregnancy-induced hypertension. And lastly, there are other forms of hypertension. One is pill hypertension, contraceptive pills. The females who use for prolonged period contraception, they develop hypertension. And increased polycythemia means when blood levels of RBCs is more, it causes Increase in viscosity, we know viscosity is a resistance. When there is increase in peripheral resistance, blood pressure will be increased. So polycythemia actually causes hypertension. And increased glucocorticoid therapy, we said, we have seen in Cushing syndrome, there is increased glucocorticoid secretion. And because of this glucocorticoid hormones, blood pressure is increased. It increases blood pressure. How? By increasing water absorption, by increasing sodium reabsorption, retention of this into the blood. Okay. So these are the different types of secondary hypertension. Now you see, this is stress, and because of physical inactivity, what happens in the lumen of the blood vessels. Here, inactivity, stress causes the muscular coat to be increased in thickness. Here, normal. See the muscular coat and inner coat and the outer coat, they are normal. Here, in atherosclerosis, because of the atherosclerosis, inner coat is increased in thickness. So, this in elderly people, those who are in elderly people, nearly 80%, 90% people are having hypertension. Why? Because of this narrowing of the lumen. Why? Because of increase in thickness of the muscular coat, because of increase in thickness of the inner coat, tunica intima. So as a result, lumen becomes narrowed. So it is an obstruction to flow, thereby hypertension develops. In normal condition, see the amount of blood flowing, through the tubule, through the arteries going. So here normal pressure. In this case, more volume of blood, it is passing through this. As a result, same blood is coming out, so it will develop more pressure, means there will be hypertension. And when blood flow is normal, but blood vessel is narrowed, also will cause increase in blood pressure. Now, what are the manifestations? Blood pressure, what are? So what? It may cause various manifestations. It may lead to manifestation of this. What is this? It may affect brain, it may affect your heart, it may affect your kidney, it may affect your eyes. So, in your blood vessel, there may be, it may increase atherosclerosis in heart. So, if atherosclerosis is there in the coronary arteries, so it may cause coronary ischemia may develop, and followed by infarction may be there, myocardial infarction may there. So, it is nothing but heart attack. So, there may be, see, heart has to work against resistance. So, it is, every time it is applying more force, more and force. So, as a result, when we am repeatedly exercising, what will happen? My muscles will be hypertrophied. Here also, the wall of the heart will become hypertrophied. As a result, lumen will be narrowed, so it will be able to accommodate less blood, so it will always try to send more blood. As a result, what will happen? There will be hypertrophy of the heart. Okay, and it may lead to, in my last class I taught cardiac failure or heart failure. So hypertrophy of the heart, pathological hypertrophy of heart, when somebody is suffering from increased blood pressure for a prolonged period, his heart ventricle will take the cone shape. When ultrasonography or echocardiography is done, then you will find the conical shape of there, because of increase in thickness of the wall and decrease in cavity, decrease in the size of the cavity, means it can now hold less amount of blood, it can eject less amount of blood. Kidney damage. Kidney damage, as I said, what happens? It affects, it causes arteriosclerosis, means renal arteries are sclerosed. As a result, lumen is narrowed. So thereby, glomerular filtration, glomerular reabsorption, this will be affected. Thereby, there will be chronic renal diseases, and it will increase blood pressure. Stroke due to cerebral hemorrhage. Okay, so we have explained different types of stroke, so it may cause stroke also in the brain. Means when the blood pressure will be increased, in the cranium pressure will be increased. As a result, what will happen? Reflexly, it will try to, when pressure is increased, it will try to constrict the blood vessels, so blood pressure will be increased. Blindness due to retinal hemorrhage, and this retina, when intraorbital pressure is increased, so this increased pressure will apply pressure on the eyeball, So when it is pressurized from the inside, so eyeball will try to come outside, So because of the pressure applied on the eye, here what will happen? The optical disc will be reddened, and there may be, because of this, there may be bleeding. As because of this bleeding, retina may be separated out. So, retinal hemorrhage, separation of retina from from sclera. As a result, what happens? There will be the blindness. So, there may develop blindness. So, these are the consequences of hypertension. Okay. So, these are explained through this. In the heart, there is blood vessel damage, arteriosclerosis, a heart attack or heart failure, in kidney failure, in brain, there is stroke, in retinal hemorrhage. Okay. Now, what are the risk factors? What are the risk factors that can develop hypertension? These are the risk factors. What are these? These are heredity. Heredity, it is inherited as Mendelian dominant. If both parents are hypertensive, 50% of their offspring, children, 50% of the children, there is a chance of developing hypertension. If one parent is hypertensive, another is normal, in that case, 25% of their children is going to suffer hypertension. So this is the relation of hypertension with heredity. And gender, age, as I said, age is important. When somebody goes beyond 40 years of age, he develops hypertension. Why? I have shown in the diagram, thickness is increased, muscular thickness increased, as the elasticity is released, capacitance of the vessel is decreased, as a result, blood pressure is increased. And race, these are prevalent in the Negroes. In the African black individuals, the prevalence of hypertension is very high in comparison to Caucasians, in comparison to Asians, so they actually suffer more. And next factor is stress. In stress, there is vasospasm, and stress causes dyslipidemia, increases blood levels of lipid. Increases blood levels of, it is also called dyslipidemia, hyperlipidemia. So, same term. So, if the blood levels of lipid is increased, it will initiate or it will cause atherosclerosis. Smoking, because cigarette smoke, it contains nicotine, contains carbon monoxide. Both are vasoconstrictor. Not only this, nicotine increases renin secretion. Nicotine also causes blood lipid cholesterol formation, and thereby in long term it can produce dyslipidemia and thereby hypertension. Smoking, as I said, and obesity. 1 kg increase in your body weight will raise your blood pressure by 2 millimeter of mercury. For every 1 kg increase in body weight will lead to increase in blood pressure by how much? 2 millimeter of mercury. So that's why, in that way it is related to, so beside, obese persons are having high amount of lipid in their adipose tissue and also in their blood. As a result, there will be more chances of developing atherosclerosis. Hyperlipidemia, as I told, dyslipidemia, sedentary lifestyle. You are not exercising, you are smoking, You are eating lot of junk foods. So because of this lifestyle, you may develop hypertension. Personality type. One, type A, like my personality. It takes very, what should I say? Anger. I develop anger very fast. Okay. So this type of personality, this type of people suffer from hypertension. Another is because in this type of personality, what is there? There is increased activity of the sympathetic activity. Means first spasm is there and vasoconstriction is there. As a result, there will be increase. Moreover, it causes dyslipidemia. Environmental factors. What are these environmental factors? One is occupation. You know, in occupational stress, now you are under stress, isn't it? You are under studying, exam. So this is one kind of stress. If this type of issue is continued for long, definitely you are going to suffer hypertension. Another is family size. The person, those who are having more number of family members in their family, there will be frequent fight, and because of this there will be hypertension. And crowding, same thing. When there is crowding, there will be chances of fighting, anger, so that may develop tension. So it may develop hypertension. Or excess, those who take excess always extra salt they take in there while they eat. So they are, and it is frequently for long term they are doing it, they are going to suffer hypertension. And alcohol intake also another cause. Now the cause of secondary hypertension. What are the diseases? These are the different diseases that may cause secondary hypertension. What are these? Congenital narrowing of the aorta, coarctation of the aorta, renal disease, I already explained, endocrine disorder like Cushing's syndrome or hyperaldosteronism that may cause secondary hypertension, head injury, cause neurological like brain tumor, head injury may cause hypertension, sleep apnea, blockage of nostril, it will cause apnea, and this will lead to hypertension. And medications like oral contraceptive pills, I already told, those who will be using regular for long OCP, they are likely to develop hypertension, secondary hypertension, and non-steroidal anti-inflammatory drugs. Regular use of this can cause because it is first it will going to damage the kidney, and thereby secondary hypertension will develop. Okay, cocaine also cause cirrhosis of liver, can cause secondary hypertension. Let us see then what are the clinical features. What are the symptoms? What symptoms you will be observing in secondary hypertensive cases? Severe headache will be there, blurred vision will be there, dizziness or gidding will be there, nausea will be there, vomiting may be there. In case of it is too high, vomiting may be there, fatigue may be there, confusion will be there, chest pain you may feel chest pain, shortage of breath means dyspnea may be there, and irregular heartbeat, and papilledema means, okay, forget it. Management. Now, how to manage hypertension? Physiological management. Another is pharmacological management. You are not going to give any management, pharmacological management, but you can give physiological management at this stage. So, what are these physiological management? Lifestyle modification. How you can modify your lifestyle? First, if your body weight is more than ideal body weight, then you have to reduce your body weight to ideal body weight. Now, how to calculate your ideal body weight? So, this is the formula for calculating ideal body weight. you can use this ideal body weight. Ideal body weight for male, this is ideal body weight. You can calculate your ideal body weight. If it is more, your body weight is more than ideal body weight, then you have to reduce your body weight. And one simple calculation is there. What is this? You can, if you want to reduce your body weight by 500 gram in 1 week, 500 gram in 1 week, what you have to do? Straight away, you curtail 500 kilocalorie of energy from your daily diet. Suppose you are taking 2000 calories, so in that case you have to take 1500 calories. If you want to if you want to lose 1 kg body weight in 1 week, in this case what you have to do? You have to curtail your daily energy requirement by 1000 calories. Means if you take 2000 calories, so you have to reduce it to 1000 calories. Then only it is possible to reduce your body weight by 1 kg per week. Okay, so if in 6 months how much you can lose your body weight, you can calculate. So this is the simple way. First, identify what is your your ideal body weight, what is the excess amount of weight you are getting. Suppose it is 11 kg, now you want to lose 11 kg. How you want to lose? If you want to lose 1 kg in 1 week, then every day you have to curtail your daily intake by 1000 calories. Then only in 11 week you will be able to lose your body weight 11 kg. But that is not advisable, but it is not possible because you may develop some other sort of disorders, deficiency disorders. So it is advisable to reduce 500 gram per week. This is another way. Reduction of lifestyle modification means you have to reduce your body weight. Then DASH diet. DASH diet means body weight reduction weight. How can you do that? No salt, low salt, not advisable, low salt diet, low fat diet, high fiber diet. When you want to increase your body weight, so you have to eat complex carbohydrate so that it takes longer time. So every time you will feel, oh, my stomach is full, every time I feel it is full. So you will be unable to eat, no? So that is, if you are, but that is good. I want to make this sort of change. So you become unable to eat. So as a result, you will take less food. So less energy means less deposition in your body. So that's why it is advisable to eat complex food and dietary fibers. Dietary fibers are very helpful. It reduces blood lipids. It prevents colonic cancer. A lot of functions are there for fibers. Okay, so by changing your diet, you can reduce your weight. Another is very simple thing, not simple, it's very tough to stop alcohol and to stop smoking. And regular isotonic exercise. Never advise isometric exercise. It may aggravate, it may cause heart attack. Okay, never advise isometric exercise. Always exercise isotonic exercise. Okay, walking, running, these are the isotonic exercise. And how much exercise? Better you do advice for morning walk. Okay, how much? 45 to 1 hour morning walk is enough. Okay, so it has to be performed daily. So this way, by doing physical exercise, you can control your blood pressure. And stress management. And another temperament, controlling the temperament. Whenever you will be finding, advise your patient. So whenever you find that is a fighting environment, you just leave that place. Don't participate in that. If you participate, your pressure is going to increase. So leave that place. So that is that temperament. Yoga therapy is very essential. Meditation it will come down your all physical activity, some organs are working excessively, so this will be coming down to normal rate. And happiness in mind and listening soothing music. Okay, so this will be helpful for managing stress. So these are the different stress management. Now there are pharmacological management. What is that? This pharmacological management. First, beta blockers. Beta blocker means adrenaline will not be able to act on heart, on SA node, on ventricular muscle. As a result, what will be happening? The heart SA node will produce less impulses, means there will be low heart rate and low force of contraction, less stroke volume. As a result, what will happen? Low cardiac output will be less, blood pressure will be less. Okay, and example, prednisone is the example of the a lot of beta blockers are available in the market. Vasodilators, so they will cause dilatation of the blood vessels, so their blood pressure will be lowered. What are these? Nitroglycerin, sodium nitroprusside, these are, and nitric oxide tablets, these are also vasodilators. ACE, as I said, ACE inhibitor. ACE what? Angiotensin converting. If it is inhibited, ACE is inhibited, there will be less formation of angiotensin 2. So, since angiotensin is less, so it will not be able to constrict the blood vessels. Okay. So, this is another group. Another group is angiotensin 2 receptor. I used to use this one, telmisartan. So, what is this? This is actually angiotensin 2 receptor blockers. In the blood vessels, there are smooth muscles. So, when this smooth muscle contract, vessel is narrowed, blood pressure is increased. So, who is contracting this? Angiotensin 2. So, if I use the blocker, this angiotensin 2 binds with a receptor, then it causes vasoconstriction. So, if I block this receptor by another competitor, means this drug, so now angiotensin 2 will not be able to bind with this receptor. So, there will not be vasoconstriction. So, blood pressure will be maintained. Diuretics. Diuretics are what? What is diuresis? Increased production of urine. So, if somebody is having increased production of urine, so what is there? Huge blood loss will be, water loss will be there. So, this is prevented by antidiuretic hormone, ADAs. It absorbs from renal tubule, it absorbs water. So, thereby it prevents excessive water loss from the body. So, when there is increased blood volume in the hypertension developed, why? There is increased blood volume. Means there is more blood, more plasma. So, I can do one thing. If I increase the water loss through urine, then blood volume will be reduced. And how this can be done? Using the diuretics. Okay. So, thiazide diuretics are commonly used those who are having very high blood pressure. Alternative therapies are also available. These are acupuncture, relaxation technique, and diversional therapies. Okay. Now, hypotension. When your blood pressure, particularly systolic blood pressure, is less than 90 millimeter of mercury, then the condition is called hypotension. Okay. So, here the main thing is systolic blood pressure. Okay. And diastolic pressure will also come down. Both will come down. And what will be the symptoms? Lethargy, weakness, giddiness will be the symptoms. And what are the causes? Long-term malnourishment. Malnourishment means undernourishment. excess eating is also malnourishment. Under eating is also malnourishment. So here it should be undernourishment. So chronic diarrhea. In chronic diarrhea, what lot of fluid loss is there, blood volume will become less, so blood pressure will be reduced. Another is prolonged bed rest. Prolonged bed rest will also cause hypotension. Primary adrenocortical insufficiency means adrenal cortex it performs hypofunction, then hypotension may develop. Acute hypotension, sudden hypertension. Suppose you are sitting for long, suddenly you take the erect posture, then there will be giddiness because temporary or acute, or there is acute diarrhea or hemorrhage or vomiting. That will, all this will cause blood loss. Blood volume will be decreased, so blood pressure will be decreased. Severe vomiting, acute myocardial infarction will also cause excessive diuresis, acute vasodilatation. Acute vasodilatation, it happens in, suppose you are exercising in hot climate. Okay, so excessive heat production is there, so body will try to lose this weight, lose this heat. So what it does, it causes vasodilatation in the skin. The hypothalamus causes vasodilatation. If this vasodilatation is very high, then blood pressure will fall and there will be hypotension. You will perform one experiment in the laboratory, in clinical laboratory. You will be performing blood pressure during supine condition and during erect posture. What are the changes you notice and why it happens? You have to know that, you have to explain it. Okay, so SBP falls by when the postural hypotension or orthostatic hypotension is, you have measured blood pressure in the supine condition, again you measured blood pressure at the erect posture. If the pressure difference is 20 or more than this difference, then it is called the patient is having orthostatic hypertension. And orthostatic hypotension, causes of orthostatic hypotension are these. What are these? Getting up from bed after prolonged illness, prolonged standing, myasthenia gravis, strenuous physical exercise, diabetic neuropathy, tabes dorsalis. Tabes dorsalis, it is an infection of spinal cord, dorsal root, and these are inflamed by inflammation caused by sexually transmitted on disease, syphilis. This syphilis causes destruction of these posterior root and ascending root. So as a result, this disease is produced, tabes dorsalis is produced. In this case, hypotension may develop. So what?